Naltrexone is an FDA-approved medication primarily used for addiction treatment. It's primarily used to treat two conditions, opioid use disorder and alcohol use disorder. Naltrexone is available in two main formulations, oral tablets taken daily, marketed as Revia and Depade, and a monthly injectable extended-release formulation called Vivitrol. Naltrexone belongs to a class of drugs called opioid antagonists. This means it works by binding to opioid receptors in the brain, effectively blocking opioid drugs from producing their euphoric effects. When naltrexone is present in the body, it occupies the opioid receptors, preventing opioids from binding and exerting their effects. By blocking opioid receptors, naltrexone helps reduce cravings and prevent relapse in patients being treated for addiction. Naltrexone's mechanism of action involves how it interacts with specific receptors in the brain. Naltrexone works by binding to three main types of opioid receptors in the brain: the mu, kappa, and delta receptors. Unlike opioid drugs that activate these receptors, naltrexone binds to them without producing any opioid effects. Normally, opioid molecules bind to receptors and activate them, producing euphoria and pain relief. Naltrexone works through competitive binding, attaching to the same receptors that opioids target. Once naltrexone is bound to the receptor, it physically blocks opioid molecules from attaching. Unlike opioids, naltrexone doesn't activate the receptors when it binds to them. The key aspects of naltrexone's mechanism of action include binding to opioid receptors without activating them. This competitive binding effectively prevents opioid molecules from attaching to these receptors, blocking the euphoric and pain-relieving effects of opioids. Section 3. Blocking the reward pathway. To understand how naltrexone works, we need to examine the brain's reward pathway associated with opioid use. Normally, when someone uses opioids, these drugs bind to specific receptors in the brain. This binding triggers the release of dopamine in the reward pathway, creating feelings of pleasure. These pleasurable feelings reinforce drug-seeking behavior, contributing to the cycle of addiction. When someone takes naltrexone, it binds to these same opioid receptors, but with a key difference. Naltrexone blocks these receptors, preventing opioids from binding and activating them. This blockage prevents the dopamine release that normally creates the feeling of pleasure and reward. By blocking the pleasurable effects of opioids, naltrexone helps break the cycle of addiction. Over time, this mechanism helps reduce cravings, prevent relapse, and support long-term recovery from opioid addiction. Section 4. Naltrexone for opioid use disorder. Naltrexone plays a crucial role in treating opioid addiction through its unique mechanism. Naltrexone works by completely blocking the effects of opioids like heroin, morphine, and oxycodone. If a person on naltrexone attempts to use opioids, they won't experience the expected high, as the receptors are already blocked. This mechanism helps reduce cravings over time and prevents relapse by making opioid use unrewarding. Importantly, naltrexone is not a replacement therapy like methadone. It contains no opioids and is non-addictive. In summary, naltrexone provides an effective, non-addictive option for treating opioid use disorder by blocking opioid effects and reducing cravings over time. Naltrexone's approach to alcohol use disorder differs from how it treats opioid addiction. Unlike opioids, alcohol doesn't directly activate opioid receptors. Instead, it stimulates the brain's endorphin system. When a person consumes alcohol, it triggers the release of endorphins in the brain. These endorphins bind to opioid receptors, creating the pleasurable sensations associated with drinking. When naltrexone is introduced, it specifically targets and blocks these opioid receptors. With the receptors blocked, the endorphins released by alcohol cannot bind properly, significantly diminishing the pleasurable feelings from drinking. This reduction in pleasure has important clinical benefits. Patients experience fewer alcohol cravings and typically consume less alcohol when they do drink. By breaking the reward cycle, naltrexone helps patients gradually reduce their dependence on alcohol, making it an effective component of comprehensive alcohol use disorder treatment. The importance of detoxification first. Before starting naltrexone, patients must be fully detoxified from opioids, typically 7 to 10 days opioid-free. Taking naltrexone while opioids are still in the system can trigger severe withdrawal symptoms. This happens because naltrexone displaces opioids from their receptors. This sudden displacement triggers severe withdrawal symptoms, including nausea, vomiting, pain, anxiety, and elevated heart rate. This is why medical supervision is crucial when beginning naltrexone treatment. Healthcare providers can assess opioid abstinence, monitor for withdrawal symptoms, and manage any complications. For opioid use disorder, the 7 to 10 day opioid-free period is mandatory due to the risk of precipitated withdrawal. For alcohol use disorder, detoxification may also be necessary, but the requirements depend on the severity of dependence. Unlike with opioids, there is no risk of precipitated withdrawal when starting naltrexone for alcohol use disorder. In summary, proper detoxification before starting naltrexone is essential. For opioid use disorder, patients must be opioid-free for 7 to 10 days. Medical supervision ensures patient safety and monitors for complications. The detoxification requirements differ between opioid and alcohol use disorders. Naltrexone is available in two main formulations that differ significantly in their pharmacokinetics and administration. These include oral tablets taken daily and an extended-release injectable form given once a month. Oral naltrexone is rapidly absorbed and reaches peak blood levels within 1 hour of ingestion. It effectively blocks opioid receptors for about 24 to 48 hours, which necessitates daily dosing to maintain its therapeutic effect. This graph shows how oral naltrexone's blood concentration peaks quickly but diminishes over time, falling below the effective blocking level within 24 to 48 hours. The extended-release injectable form, known as Vivitrol, is administered as a single intramuscular injection. It slowly releases naltrexone into the bloodstream, providing a steady therapeutic level for approximately 30 days. This comparison shows how injectable naltrexone provides consistent therapeutic levels over 30 days, while oral naltrexone requires daily dosing with frequent peaks and troughs. The extended-release formulation provides significant advantages for treatment compliance. Instead of requiring daily adherence, patients only need a single monthly visit, which removes the daily decision to take or skip medication. This is particularly valuable for patients at high risk of relapse. Section 8. Side effects and considerations of naltrexone. Naltrexone can cause several common side effects, including nausea, headache, dizziness, anxiety, and fatigue. Unlike opioid replacement therapies such as methadone or buprenorphine, naltrexone does not cause physical dependence, and patients don't experience withdrawal symptoms when stopping treatment. An important consideration is that naltrexone blocks the effects of opioid pain medications. When naltrexone occupies opioid receptors, it prevents pain medications like morphine or oxycodone from working. Therefore, patients on naltrexone who require pain relief need alternative pain management strategies. These alternatives include non-opioid medications, physical therapy, local anesthetics, nerve blocks, and various non-drug therapies. It is crucial that patients and healthcare providers discuss pain management options before starting naltrexone therapy, especially for those with chronic pain conditions or upcoming surgeries. Naltrexone's effectiveness in treatment has been extensively studied. Research shows that naltrexone is most effective when combined with behavioral therapy and counseling as part of a comprehensive treatment program. Clinical studies demonstrate impressive results. Injectable naltrexone can reduce opioid use by 90% in some patients. For alcohol use disorder, naltrexone has also been shown to significantly decrease alcohol consumption and reduce heavy drinking days. However, effectiveness varies significantly between individuals based on several key factors. Among these factors, motivation to remain in treatment plays a crucial role in determining outcomes. Patients who are more committed to their recovery process generally experience better results. The research is clear. Naltrexone combined with comprehensive behavioral support offers the best chance for successful recovery from opioid and alcohol use disorders. Section 10. Emerging uses of naltrexone. Beyond its established use in addiction treatment, naltrexone is being investigated in much lower doses for a variety of conditions. Low-dose naltrexone, or LDN, is being explored for several emerging applications. Researchers are investigating its potential benefits for autoimmune disorders like multiple sclerosis and Crohn's disease. It's also being studied for chronic pain conditions, including fibromyalgia and complex regional pain syndrome. Additionally, there's growing interest in LDN for psychiatric conditions such as depression, anxiety, and post-traumatic stress disorder. At low doses, naltrexone appears to work through different mechanisms than at standard doses. When used at doses of 1 to 4.5 milligrams, which is much lower than the 50 milligrams used for addiction, naltrexone appears to have anti-inflammatory properties. It may also modulate immune system function, potentially by affecting cytokine production and regulatory T-cell activity. However, it's important to note that these applications remain largely experimental. While some clinical trials show promising results, more rigorous research is needed to establish efficacy, optimal dosing protocols, and safety profiles for these emerging uses.